one.
Welcome everybody, this is the podcast from the first day at PICS 2019 here in the beautiful city of San Diego. We had a wonderful session today, opening day, and we're just going to go through a few highlights. We started off with the quality session. After last year's meeting, there was such interest and we felt that we should have the quality session as something that was standing out on its own, and really it did stand out today. I learned a huge amount from it. We had a number of talks. The first one was There's More Than One Way to Skin a Cat from Lisa Bergeson from Boston, and really what was interesting for me in that session was the fact that as we look at parameters or outcome measures for quality, that we need to be careful that we're not actually causing more morbidity to our patients as we start to try and reduce radiation doses, or as we start to look at maybe how we implement new interventions in our lab and try and do it in a safe way. It has to be effective though, outcomes have to be effective. So I thought that was a really pivotal part of that. We also had a representative for the NCDR, Dr. Brindis, who was talking about how potentially or what patients want from outcome data, and really what they're looking at is numbers, and that was very interesting for me as a physician to know that that's potentially what patients are looking for. And we then moved on to our first symposium of the day, which was the PDA Suposing. We had a great live case again from Memphis. One of the things that I again found very interesting was the device choice. The only FDA approved device now for transcatheter closure of premature PDAs is this Piccolo device from Abbott. Shyam, who did the case from Memphis, chose a 4.2 device to put in, and we asked him why he chose a 4.2. He feels that really in deploying these devices in prem babies, he likes to have the device within the ductus, so it has to be intraductal. Shyam actually gave a presentation about the Piccolo experience with the Piccolo device in kids babies less than a kilogram later on in the day in the abstract session. He's done over 100 babies now, and really the outcomes are excellent. But as the session went on, that PDA symposium went on, we really started to figure out, are we doing the right thing? Because we still don't know. Dr. Benedis came from Stanford to talk about whether or not there's enough data to advocate for PDA closure, and really we don't have those data yet. We had some great talks and case presentations about PDA stenting from the group in Texas, and also, as I mentioned, the debate between Brian Goldstein and John Nigro. What I thought was really interesting in that is actually to see the surgeon and the interventionists agreeing with the fact that PDA stenting really should be the primary therapy now for patients with duct-dependent circulation, and both, I think, parties agreed on that, which was wonderful. We then had a number of lunchtime sessions on advances in imaging modalities, still learning from our interventions, and also from interventions in adult congenital heart disease, again looking at ways how emerging technologies in the pediatric field may augment and help adults with congenital heart disease to ensure that we're minimizing interventions throughout patients' lives. We then had our second symposium of the day. It was a PFO symposium where we had a tape case from London on Iqbal Malik, where he presented a PFO with an aneurysmal atrial septum and closed it with a uni device from Occlutech, and did an excellent job on that. We then had Jim Thompson from Virginia talking about suture-mediated closure and trying to lessen the front print that's left across the atrial septum and the implications that has for the future for accessing the heart. And then we had a wonderful live case from Denver, again a PFO closure using the Abbott device, and executed excellently, of course, by John Carroll, who's a master interventionist. And we finished up the day then with our, I suppose, younger investigators for the oral abstract section, which was wonderful. We had a number of abstracts presented, everything from transcatheter pulmonary valve replacement to new and emerging technologies with the Altera adaptive pre-stent, and finally finishing up with right ventricular outflow tract stenting, which for me, again, as an interventionist using RVOT stenting from the Birmingham group, showing that even when we actually put the RVOT stent below the pulmonary valve, that the salvage rate of the pulmonary valve intraoperatively with the full repair is still actually only less than 10%. So I think we had a great day, very exciting. We're looking forward to tomorrow. The meeting will start, I suppose, proper with the true live case format, and we're hopeful and sure that tomorrow is going to be a great day as well. So tune in.
And the website is?
The website is www.picsymposium.com.